So let me just pull the slides here. And, oh, sorry. Here we go. All right. Hey, Sarah. Good to see you. All right. Let me run through a couple announcements before we get started. So my name is Charles de Vilmorin. I am the CEO and co-founder of Linked Senior, which started and is leading this platform called Activity Strong in partnership with Activity Connection, NAP, and NCAP. And so we're very excited to introduce our second session of today's summit. Before I do that, a few kind of logistics item, which is that up to 6 NAB, NCAP, NCTRC, and NCCDPC credits are available. To earn these credits, you need to attend a full session. So at the very minimum, 1 up to 6 sessions today. And please fill out the CU survey no later than midnight on Friday, which is June 25th. So we can process your certificate of attendance and again issue up to 6 hours of these CUs. Please, due to the very large number of attendees today, the certificates will be sent throughout next week, so the week of June 27th, and no later than Friday, July 1st, by the end of the day. If you have any questions, please send them to webinars with an S, webinars@linkedsenior.com. As a reminder, this session is being recorded, and as many of you are very familiar with Zoom, we are using both the chat and the Q&A feature for dialogue. So the chat is more like to speak to everyone, and if you want to speak to everyone, please select everyone in the drop-down. And then if you have a question directly for today's panelists, please select more the Q&A feature. And last but not least, for the ones that are playing our virtual bingo game, the the code word for today's session is the word is. Whew, that's a mouthful, sorry. So very excited about today's session. This is our second session today. And what I'd like to do is briefly ask each of you to introduce yourself. So Lynn, if you don't mind, let's start with you and then go on to Chip, and then Sarah, if you don't mind, as our esteemed second moderator, then introduce yourself and starting this session up. Thank you so much.
Sure. It's great to be with you all. My name is Lynn Katzman, and I am the CEO, both Chief Executive and Chief Engagement Officer for Juniper Communities. Juniper Communities today has 30 buildings in 4 states. We operate across the entire care continuum, and have been doing some great work together with Sarah and my team internally to develop some wonderful new engagement programs that will begin to form the basis of the entire senior living experience we provide moving forward. So I'm excited to be here. Thank you. Yep, all yours.
Thanks, Lynn. Chip Gabriel with Generations. I'm the executive chairman of Generations. I've been with the company for 33 years now. The founders of Generations, next year we're celebrating our 80th year in senior housing. Wendell White, who's my partner's father, he was 5 years old and literally grew up in the back room of a 5-bed rest home in Southern Oregon in 1943 when they started. And today, him and his wife, Betsy, are actually residents in one of our communities in Portland, Oregon. We have 11 communities, 2,300 units, the full continuum of care. Most of our communities have multiple levels of care. Part of that, I have a younger sister who, her first 10 years of her career, she was a 2nd and 3rd grade teacher. And since that time, she's been an activity director in our communities. So right now she's the activity director of our memory care community in Portland, Oregon. So excited about being here today and help share with you guys.
Chip.
Always so excited to be on the same stage or virtual stage as Lynn and Chip. So thanks for having me join. I'm Sarah Thomas. I'm CEO of Delight by Design. We're a boutique consulting firm focused on person-centered design at every age for brands and experiences and spaces. I'm an occupational therapist by clinical background, and have really focused on age tech and the intersection of technology and the aging experience, and how we can look at experiential design to enhance how we live at every age with more engagement. So this is a perfect panel to kick off today. So thanks for having me join.
Thank you so much, Sarah. Well, I think, probably one of the best ways to start is, going back to our topic, which is that C-level leadership enables the purpose of resident engagement, right? So in preparation of this session, Lynn and Chip, we connected about this idea of CEO as in Chief Engagement Officer. And Lynn, you introducing yourself with these words. Do you mind sharing a little bit what that means, obviously for you, but as it trickles down within your organization, how do you, quote unquote, operationalize that?
Sure. Well, I think the first thing to say is that post-COVID, we've learned quite a bit. We know now how important engagement is to well-being, the amount of depression, the amount of issues that older adults, that we all faced during COVID. We understand better now, post-COVID or post the worst of the pandemic. I don't think we're fully through it. And so I think engagement has risen in importance for all of us. In terms of how it plays into resident well-being, I think our goal as senior living providers is to oversee and provide or foster or enable well-being. Well-being is not just about care. It's not just about service. It's how you spend your time. And that's all about engagement. And so if you believe that well-being is a product of all three of those things, not just one or two of those things, then as a CEO, however you want to explain what that is, you need to be involved in making sure that you promote engagement as equally important to care and service.
Thanks, Lynn. And Chip, one of the many things I enjoyed in connecting with you over the session is you sharing the fact that you have an activity director very close to you and your family. And I'll let you kind of disclose that. But you explained to me a little bit this position that you have called the Vitality Director. Would you mind explaining that a little further?
Sure. We have, and we like to call it, it's not a corporate office, we call ourselves the support office. And we have a Vitality Director who oversees what we call Vitality with Generations. And that encompasses the whole person. It's mind, body, and spirit. It's what our residents eat. It's what activities they have. It's how do we get to know them and their life stories before they move in with us. And so we think, when residents choose to live with us, that's really a sacred thing, that we get to be their home, their family, all those types of things, and to make their lives wonderful. We think just because they're seniors, they've still got a lot of life to live. And that means different things to different people. So we have to get to know them. And we want to get to know them before they move in with us, so we can make their transition to live in one of our communities a successful thing. Where they grew up, what their kids did, what they did professionally, what faith they have, how engaged they are. Knowing those things is making their experience when they move in that engagement critical. So I think for us, it's that holistic person. We want them to move to our community and write amazing chapters to the remainder of their life, whatever that may be, wherever they're at physically, mentally, we can have impact with them, but it's by getting to know them and doing that. And so our Vitality Director, Erin Rose, is the person in our company. She doesn't just oversee activities, but she helps oversee that holistic thing, from diet, engagement, all those types of things, and what that means to our residents.
Thanks, Chip, and thanks, Lynn, for these thoughts. Now, obviously, being, I think I can say I'm an activity professional myself because I went through MEPAP, right? But often what I hear as activity professional evolve in their career is, at least historically, quote unquote, the lack of funding. And, Lynn, going back to your comment, when you said that we understand better, I was curious to hear from both of you, what was the aha moment in the pandemic? So whether it's some specific event in 2020, this aha moment where we're like, gosh, we didn't do enough before, let's try to do more. Do you mind walking us through that? And what kind of, yeah, go ahead, Lynn.
Yeah, I think there are a number of answers or levels to your question. First of all, during the pandemic, the height of the pandemic, we really looked at a hybrid vehicle for engagement. And so if you recall early on, people couldn't leave their apartments. That wasn't part of what we did. So virtual activities, which you were a huge proponent of, Charles, and Juniper also did with a group called, we put together something called Virtual Connections, so that people could access different types of activities and engagement opportunities online. And while we don't have the same need for pure virtual engagement opportunities today, I think what we've learned is that both are important. And real-time versus asynchronous virtual opportunities are both important. And I think Activity Strong has been a big proponent of that and has offered a number of opportunities to access that type of programming. So I think going forward, you're going to see more of that. I think in terms of engagement, we've redefined engagement. And I think Sarah can comment on this as well, but we look at we hope to look at our communities as community centers that are integrated with the community at large. And I know Chip is doing this too in a number of his communities, where our communities are open to those people who don't live in our apartments, as well as for the families and the grandchildren, and obviously our residents to gather. We have lots of spaces. We want to use our environments differently. And the engagement we hope to offer, I think, will change over time. Now, what does that do to the cost? You mentioned budget. Virtual opportunities, depending on which route you go, can offer you greater variety and more options for engagement programming than you might have if you were just using your own team members. So I think that offers an opportunity for greater customer satisfaction. Opening up your community to the community at large, you in some ways may long-term reduce some of the expenses associated with your team members, in terms of you have more opportunities for bringing in people from the outside, that you may offer something different than cash in return. But I think it's really important to say that all of that has to be coordinated. And so at Juniper, we look at a high-tech, high-touch model. So some of that will happen through technology, and that's perhaps a question further on in this conversation, but it's also coordinated through an individual. And that individual we call a lifestyle concierge. That person's primary objective is to help organize for each individual a personal calendar of programming that supports their engagement, the outcomes from which are a sense of belonging and purpose. So I hope that answers your question, Charles.
It does. Thank you very much. Chip, any additional thoughts and anything about that quote unquote moment for you when you saw this? Yeah, go ahead.
I think for me, in our organization, when the pandemic, we realized really was doing, it was just the fear that we were all living with. It wasn't just fear for our residents, but our employees. And we all ended up doing different jobs that we didn't get hired to do. And activity staff became housekeepers, they became wait staff, they became food delivery people. Our executive directors became cooks, all those types of things that changed. And I think that interaction will continue going forward. I think We've talked about, and Lynn does a great job with her company too, is that, our reputation, I can tell you all the great things we do, but my reputation is the evening maintenance guy. It's the wait staff, it's the housekeeper, it's the activity director. And that's where engagement happens. It's not some corporation given a policy and telling you what it's got to do. It's how I treat my staff, how our leadership, our support office treats those people, how we engage with them, how do we care about their families. And by showing that love to them is how they show it to our residents. And that's what engagement is a meaningful life. And we always have a little phrase here, we don't want to be the biggest, we just want to be the best. And that's, we want people to tell their friends that they should live here or tell their neighbor that you should work here. To me, that's kind of the ultimate question. And we do that. So I think the pandemic has just brought that up, that the dedication that people have and that engagement is just living together and in meaningful, fulfilled ways. And that's different to different people, but finding what that is. And we're all valued, and we truly appreciate it in a different manner than we did 2.5 years ago. We don't take it for granted anymore. So I think the one thing that Lynn touched on, I would add to it, is that we very much want to be a part of the community, and we want our residents to not feel isolated. To retire, one of the definitions is to put away, and God forbid my kids ever put me away. And I want to feel that same about our residents and their families, their grandchildren or whatever, but they're there to thrive and to live and to make the last days of their life meaningful, and that they, candidly, that they die with us and with purpose and value and with this sense of it was a life well lived, whatever that may mean. And that could just be the last little bit of their life, but it's done well. And I think that's our activity people, and whatever we want to call them, they're the frontline people to make that happen. And we are there to support them. And the return on investment on that is that you have residents living longer, better, and your reputation is better. And to me, that's what it's all about. That's what I want to live as I live the remainder of my life.
Agreed. Well said.
Can you hear me this time, Charles?
Yes, we can. Thanks, Sarah.
Okay, great. So before we dive into actually how you're doing this in your communities, I'm interested in your definition or your perspective on social prescription. Could either of you take a stab at that?
Sure, I will. You got to think about life in terms of well-being. And to Chip's earlier point, at the end of the day, what do we want? We want more years, but we want quality in those years. So in order to really provide that type of experience, that sense that you've lived every day fully, that you've been, as we at Juniper call it, alive in all seasons, it's really important for us to make sure that engagement is part of the prescription for quality living. And so you can call it a social prescription, largely because it involves, in many ways, some kind of social activity, but it is part of a prescription for living your best life.
Lynn nailed it. I think it's unique for each person. So it's taking the time when someone's thinking about moving in with you to get to know them, to understand what is important to them. And sometimes it takes a while to bring that out of people and doing that. So I think for us, our sales team, they're kind of the front line when that happens, but how do you transition from getting that to moving in and meeting people with where they're at and their backgrounds and their histories and their wants and their needs? We're all kind of, maybe Lynn and I aren't shy, but a lot of people are shy, and it takes a little while to pull that out of them, to get to know that. But I think we can do that. And that's called a relationship. And that's what we all want, is relationships. And a lot of our residents, they create wonderful relationships because their kids or grandkids are busy living their lives and doing those things. So we get the privilege of becoming those relationships with our employees. And I always say our housekeepers know our residents more than anyone else because they're in their apartments. They get to talk to them. And, I get really mad. We've taken over a couple of communities that were run by a national company. and the housekeepers had, 17 minutes per apartment to clean. And it was doing that, like, that's so wrong, because those people, it's different. Maybe they need more cleaning, but more times than not, they're in engagement, and they could tell me more about a resident's health and what's happening and changing more than the nurse can. And so it goes back to relationships and taking the time to get to know people with where they're at and making their life meaningful.
Yeah, I think that's so important. And I think it probably is a good segue to, 2 points to this next question. How do you get C-suite engaged with your enrichment programming and life enhancement and engagement? And then how do you get, really every level of buy-in so that they're all involved in your engagement? Any strategies from either of you?
Let Chip take this one first.
Sure. It's easy to talk the talk, but you have to walk the walk. And so for us, we have to be in the buildings. Our support office, I'm here today in Portland in our office, and it's pretty empty because they're in the communities, and you have to know your employees. You have to know your department heads. You need to know about them and their families and find out what's important to them. And I believe if you get to know them, if you get to care about them truly, and we got to prove this in spades during the pandemic. And we were in our buildings during the pandemic because we were cooking and doing what else we need to do to take care of our residents. If you do that, then if you care about them, then they're going to care about the people they're supposed to care about. But you can't just write a policy and email it out and tell your executive director you got to do it. You got to go walk the walk. And I think that's the key. And if people change over time and different parts of care. So there's always transitioning with leadership, with people, but you've got to take the time and create that culture internally. So it's walking the walk, not just talking and doing it.
Yeah, Chip, and you're known for that for sure. And I think that you've set that culture throughout your organization and the industry. And working closely with Lynn and your giraffe costumes, I know for sure that you walk the walk. So
I get in trouble from our HR people. She says, Chip, you can't keep hugging people. Someone's going to take that wrong. And I say, I'm going to keep hugging. I'm sorry.
Yeah.
I'll take that risk.
Agree, Chip. Totally agree. You talk, if I can, Sarah, you asked about how do you manage this at the top and throughout your organization. And I think Chip said it. It's about culture. And what is culture? Culture is a set of values and the activities and experiences that bring those values to life. And so at Juniper, we're very concerned and careful, and we put a lot of effort into culture. And we understand that our culture is really built around what I said before, allowing all of us to live fully throughout any season of life. Everything about Juniper, you'll see us talking about that. And that's our North Star. And so for me as the company's leader, that's what I keep repeating. It's often about communication. It's about being a servant leader. It's about, as Chip said, walking the talk. If I walk the talk and hug people and get to know their names and understand about their families, it means the world. When I give out giraffe awards, little gold giraffe pins, they're kind of crazy, but they mean the world to people. And why does someone get a giraffe pin? Because they've stuck their necks out for another human being. And that's at the end of the day what it's about. So, how does this work throughout an organization? It starts at the top. It also starts at the bottom, and it has to be throughout. We all have to believe in something. We all have to have some kind of shared purpose. And I think that engagement and the building of relationships really is the core of what we do in senior living. And so if as a CEO, you don't recognize that, I think your the environment that you create, the culture that you create, will not be as rich for our residents, but also for our team members. And in today's world, we really need to be both.
Yeah, I would add one thing to it, which I think is understated, and I know Lynn does this. You know, we are in a staffing crisis, but one of the things that we've learned through this is people who don't want to be a part of that culture, we need to let them go. And I think too many companies, and what that does, it demoralizes the people who are doing the right thing because the people don't care, whatever. And I think that's the hard lesson that we've gone through and really realized in the last probably 12 months is that we're desperate for staff and doing things. And there's some bad apples and you try to just put up with them. And once a week, they no call, no show, do whatever, or they show up late or they don't wear their uniform or whatever it might be. You got to let them go because you're destroying your good people. And I think that's one of the hard lessons that we've learned is if someone doesn't want to be, you know, the Juniper way or the Generations way, they can't be a part of our company because they're going to bring everyone else down. And that's been probably one of the hardest things that we've been dealing with is staffing and firing people when there's no one to replace them except someone who's going to work a double the next week.
I think that's also true of recruitment. I'm sorry, you know, particularly when you're in a staffing crisis, recruiting someone who buys into your culture is really important. If you don't, things don't work as well. Sorry, Sarah.
No, yeah, we're gonna speak the same message here. I think that you keep the good ones by preserving that culture, and if you bring new people on or if you tolerate behavior that's not congruent with your culture, I think that you lose the spark in all of those individuals who are really committed to the mission that you're on. So I think you both are setting great examples there.
Thank you.
Thanks, everyone. Thanks, Sarah, for that. Lynn and Chip, thanks for the kind of focus on culture. But I think, you know, the other, what that had me thinking is kind of realizing also that you lead teams and operations in multiple states with hundreds, if not thousands of team members. And ultimately, you know, measuring something somewhere in resident engagement, the use of data is critical. And so I was wondering what your thoughts were on what type of data, what type of information was needed to enable these models. And Lynn, I know you're particularly fond in data, so I'd love to hear your thoughts first if you have anything to share there.
Well, you know, at the root of everything we do is understanding the individual, is personalization. And in order to understand an individual, you need to get to know them. And that's done one-on-one, but because there are many who serve an individual, it's really important to be able to share that information. Technology affords us the ability to share that information. We use some of that tool called My Life Story. We also collect other information now in as part of our new Catalyst program, both of which require us to take in those data and be able to share it on a technology platform. One of the key things in terms of understanding an individual is understanding what they're actually doing. Some people say one thing but do another. And so one of the benefits of, for example, Linked Senior is that it helps us understand what people are actually using. What are they doing? How does that come to pass? And it gives us some of the data we need in order to develop programming, which truly is responsive to individual needs. So Charles, I'm not sure if that's where you're going with that question, but I'll stop there unless you have a follow-on question for me.
I hear you.
Sorry, I had muted myself. No, that's great. That's great, Lynn. Chip, would love to hear your thoughts on that one as well.
You know, I think for us, it starts before a resident moves in, is getting in their home or apartment. And, you know, we can't like to have our salespeople meet someone twice before they tour community to get to know them. as you go up the acuity scale, it's tougher to do. But it's getting to know them, and get to know them, their background, see where they live, what they do, and that type of thing. And then it's really, we go through a process. We use a Sherpa software for marketing, and it's a whole form and data that they fill out. So we get that. And then how do you aggregate that into your community when they're moving in? And to even what residents have some of things. So you can help them create friendships and doing that, and have active resident councils that engage that. We are working right now, building out a data platform internally, one for our key things, but also just to do a better job, and particularly with the independent living residents that we have, tracking the social determinants of health in real time. So when they're using the health club, when they're going to an activity, how often they're going to the dining room, what they're eating, what they're ordering in the dining room, then overlaying that with their medical records to do that. So we think over time, we're going to have a much better holistic understanding of the resident and doing that. And I think Lynn and I are both involved with various national trade groups and that type of thing. And one of the questions they ask us is, are the people moving today, are they higher acuity than they used to be? And we know subjectively that they are, but we should in real time know with data, yes, what chronic diseases they have compared to what they used to have, what other mobility issues compared to what they used to be. And we all have a lot of subjective data, but we should have hard facts. And if we're gonna, as leaders in organizations, and we're part of a continuum of care with the health systems and government and public policy, we need real data to have impact on that. And I think that's one of the, I know Lynn's one of the leaders in the industry with doing that, and we're working doing that. And not a lot of operators are doing it well, but they're going to be forced to in the years to come, as we are part of public policy with an aging population that we can't afford to pay for anymore. So data's going to be driving it, and it's something we're all doing. But it's, it goes back to still getting to know your residents and where they're at in their life and their journey, or whatever season they're in.
So, I'll just add one thing, which is, thanks for that one, by the way, Chip. Anyway, if we need data to help us determine how to best serve people, to allow them to live their best lives. But we also need, as Chip was pointing to, outcomes data. What is this doing? What impact are we having on depression, on social isolation? And so I think both are really critical to move engagement up in its importance. We in this environment, we all know it's important, but we've got to talk to others about it, and we've got to demonstrate it. We've got, evidence-based service is really important if you want to elevate something in business. And I think that that's what we will soon be able to do. And I think part of what the effort is among activity professionals and companies like Link Senior.
So, Chip, did you want to follow up with that?
Lynn and I both can talk about, we get a little passionate about this. I was going to share, I've got a large community just outside of San Diego, Paradise Village in National City, it's a big campus. It's 460 apartments from independent living, assisted living, and memory care. And I've got 107 residents who are participating in a 5-year study with University of San Diego, UCSD. They got a $5 million grant from IBM who's tracking residents who live in a planned community versus seniors who live in their own homes. And it's a 5-year study. And we have a very active, wonderful vitality program down there. And they're, several years through the study. And it's already proven that cognitively and physically, how much healthier the residents are who are in a community where there's socialization, where there's activities, versus living in their own home. And that's, what all you folks do every day, and you see that, but I don't think you see people who are living at home, isolated, single majority of them, with not the same, I'm describing my mother, by the way, where they're not doing that. And we saw that with COVID, with people thinking social, how their health deteriorated physically and cognitively. And so I think what Lynn was talking about, we know that it's doing that, but we've got to give data to prove it, because that will change public policy and focusing dollars and resources to do more of what we know changes people's health and well-being. It's engagement.
You know, I think we could probably not ask another question, and the two of you would bounce back and forth just because that's how passionate you both are. That's what we love about you. But I'm curious I'm watching this chat function of this other level of conversation going on, because a lot of the people, there's 650 people, 700 people joining us at any given moment. And they're all boots on the ground. A lot of them just like really implementing it. And you guys are so data driven, and we need this. We need the commitment of Lynn and Chip to move the data story forward, to prove, how we're going to move enrichment as an industry forward. But I'm interested from perspective of justifying ROI, because a lot of these buildings don't have the level of engagement and commitment that you both do. And I think partly it's because they don't necessarily know how to quantify and even qualify the ROI. So do you have a way that you're looking at, is it occupancy, is it marketing, is it satisfaction? What are the biggest drivers for the ROI for you guys?
Gonna go?
I'll jump in real quick here. I think we're blessed that we've been doing this for 79 years now. And one of the things, especially our bigger communities, as we go to our lenders, our capital partners, I've gotten criticized multiple times. Our margins aren't as good as some of our competitors because we do spend more money on more food options, more activities, more socializations, more stuff we do for the community that doesn't live with us. But we consistently have a lot higher census and spend a lot less money on advertising and marketing than a lot of our peers do. And for us, we don't look at, we need to be fiscally responsible. We're here to make money. But we have a longer term perspective. And I think that's one of the challenges with a lot of organizations that are driven by it's private equity, why it's public money, that it's all margins and it's quarter to quarter to quarter. And for us, we take a longer term perspective, and we want to have partners and relationships that does work. And over time, I've done over 4,000 units of senior housing from ground up development. And I've got about 1,200 of those are still my properties because we didn't have the right partners or the timing wasn't right. So I think for us, it's those right relationships. And we make a fair return on our investment, but we also have a much longer term perspective. And I think what was proven over COVID is kind of the peaks and valleys that you go through with business cycles is ours tends to be a little more flat, where we did not as bad as some of our peers during the pandemic, and we're probably not doing, when things are going great, we're probably not doing as good as some other people on a short-term basis. But over time, we've got a good steady business model. It's worked for our family really well. And, I've got 2 sons who are the 5th generations, and I hope they can do it for a long time too.
So for me, ROI is important. I've just spent the morning talking about ROI on technology, which is a very interesting topic, I won't go into at the moment. But on engagement, again, I go back to where I started. We view wellness as our value proposition. If we can help you live your best life, meaning that you are healthy and engaged, you have a sense of purpose and belonging, that's what we want to do. So how does that pay off? It pays off in customer satisfaction. As Chip just said, if people enjoy their experience, their life experience with you, if they're it's better if they can communicate it, but if not, if you have the data to show it, what tends to happen is that your building, your occupancy is higher, your length of stay is longer, and the loyalty that you get from those people enables you to reduce your costs for marketing because you have greater friends and family referrals. And those are the cheapest, best referrals you can have, word of mouth referrals. That's one place. The second place, and I'm going to go into Medicare Advantage and some of the payer sources for a moment. You know, the most expensive cost in our system is medical intervention, and yet medical intervention does not determine health. It determines only 10%. If you look at that hierarchy, you see that what determines health, 10% is medical intervention. 20% is where you call home, 30% is genetics, and 40% is lifestyle. Right? So the majority of what determines well-being or health, and hence the cost to society for you over your lifetime, is really determined by how you live your life. So from a Medicare Advantage perspective, if you're looking at return on investment, you can increase your length of stay, you can reduce your marketing costs, but we keep people out of hospitals. And if you keep people out of hospitals, you're making a lot of money for the federal government. You're reducing their Medicare spend. So one of the things we at Juniper have been working on for a very long time is how to capture the value that we create in keeping people healthy, in improving their well-being, and keeping them out of hospitals. So one of the ROIs we look at for engagement as part of overall well-being is that we reduce our hospitalization rate, our readmission rate, and that in turn creates great value, not just for us in the community now, but for those who pay for the lack of health and well-being in the older adult population as a whole. So from an ROI perspective, while it's still perhaps a couple of years out to really see us capture that value in terms of revenue and therefore return on investment, it's there. And I think all of the data point to its success. And again, if you look at what determines health, it's engagement. It's where you live. It's the people you engage with. It's your lifestyle.
Just a quick statistic to back that up is I was meeting with the head of geriatrics for Kaiser in Southern California a little over a month ago. And I've got in my community in San Diego, as mentioned earlier, I've got over 60 Kaiser members who live there. And he had no idea he had 60 of his members who lived at that community. He told me every time we call 911 and an ambulance comes and takes them to the hospital, it costs Kaiser on average $30,000 when they leave a retirement community. So you save one or two of those a month, it's real money to Kaiser Health System. And that's where the light is going on that Lynn is talking about.
Right. And so the big issue for us is capturing that value, making sure that we can get a piece of it. And we're working hard on that in the industry, but it flows right back to activities professionals and your ability to keep people engaged in activities in sense of purpose of belonging to a community on a day-to-day basis.
Yeah, I'll use an example of that just for all of you. So a classic example is, my mom who spent 3 months at Paradise Village, and she's a quilter, and they have a quilting class every Thursday morning, and my mom's got the group. But as soon as someone misses a quilting class down there, the woman who runs that quilting class goes and visits her and say, "We missed you." "Well, I don't feel good." "Well, why don't you feel good?" "I just haven't had my energy the last 2 weeks." Well, that's a cue to make sure to do some blood work, see your primary care physician, see what's going on before we find that resident on the bathroom floor with some health incident and we're calling 911. And that's where we're all involved with this process. You see those residents every day, and when there's a change of condition before their children usually do, or before their physician does. And you're a part of that health system that Lynn's talking about, that we all have impact on this on a day-to-day basis.
Thanks for these. It's great because you're kind of answering the questions before they're being asked. You're kind of bouncing off each other so great. But there is something that I have been waiting for a long time to ask you both, and obviously today's kind of a great day to do this. Lynn and Chip, your work is amazing. You're awesome. Like, the industry needs people like you. But I think that realistically, when you look at the whole industry, I don't know the right number, but I would venture to say that less than 10%, if not less than 5% of leaders like you see this, right? Have this vision, which is great, and we obviously want more of that. And to Sarah's point of view previously, if you look at the chat, there are many professionals saying that their organizations unfortunately don't see that yet. So you've kind of helped us connect kind of the dots at the high level. Was wondering if you had any direct advice, say I'm an activity professional listening to the summit today, and my organization isn't there yet. Where's my agency? What can I do tomorrow as I talk to my ED or my administrator? I mean, obviously, I don't want to get fired and all of that, but help me kind of guide that discussion towards change. Chip, I know I'd like to pick on you because, maybe as a cue to start, you talked a little bit about the blue zone and these models. Anything you'd like to share with us?
I think what Lynn was just talking about is, as a society, the federal government can't keep paying Medicare like they've been doing. And they're trying to, I'm convinced that the vast majority, I think in 3 to 5 years, 70+% of every senior is going to be on some type of Medicare Advantage plan. And that means that insurer is going to get so many dollars a month to care for that people. And if it costs more than that, they're going to do that. And so as we get that paradigm shift, seniors spend more money on healthcare in our government than anyone else. And it's keeping them well before they get sick. And that is the engagement that activity has to do. So I think what's going to happen in the next, I think maybe 3 to 10 years, I think it's going to accelerate, is we're going to start through technology, quantifying the health and wellness of people. And you mentioned the blue zones. For those who've done, National Geographic hired the guy Dan Buettner to study throughout the world where a higher percentage of people live to be centurions, 100 years plus, and what were the commonalities. And there's kind of his 9 PowerPoints, and it's movement, it's sense of purpose, know your tribe. They're great things, and we're partnering with them to create blue zone communities. We're rolling out in September, October, come to our larger campuses. But what that is, it's just all the things that keep people healthy, better, longer. And it's all the stuff that everyone here does. And I think by just learning, keep bringing it up to your leadership in your communities, where it's going, because all of a sudden the light's going to go on, because this is going to happen, that the typical company that's not thinking this way, the insurers are not going to want to do business with them. And they're going to be forced to do it sooner than later, because what we're doing, the health and wellness, is keeping people healthy and treating proactively wellness versus the healthcare system, which historically has just treated sickness. It's a sick care system, not a healthcare system. And what it's switching to, and we're going through starting a messy transition, is health and wellness and purpose and fulfill life till the end is what's going to be more important. And 2 books that I would highly recommend, Blue Zone, they've got multiple books now, but learn about that. And then Being Mortal by Atul Gawande, which talks about our healthcare system, and he's a fascinating writer. It was a New York Times bestseller. Great stuff. And I think I keep them here. I give them out to people in my office. I think that's what our industry is about. And I think as much as you can educate yourself, do a great job, and keep talking to the value, I think all of a sudden, sooner than later, the paradigm is going to shift in what you on this Zoom do every day, what value that is. And companies that don't quantify it, measure it, they're not going to last long term. I just think that's where it's going. I hope.
Thanks, Chip.
I think you
Any
both
thoughts on that?
yourself well in and kind of help the industry to define where it fits in the ecosystem. Many people had only talked real estate or hospitality, and wellness and prevention and care and purpose and lifestyle are all terms we need to be discussing. There's great value that is of cost savings, and then human value that's certainly driven through your place in the ecosystem. I would like to look a little bit at
key differentiators that you have in your engagement programs that you feel might be different than what is out there for others. And I'd like to look at that through the lens of many people talk a talk, and you guys talk the talk and walk the walk. I think what the website says and what the marketing campaigns say, those people are a part of an organization, and then there are frontline individuals every day rolling up their sleeves and actually doing the engagement. And sometimes there's a separation of what we're marketing and what we're actually delivering. But I see you both as differentiators and your level of commitment, throughout the organization, throughout your programming. So is there anything that you think is your secret sauce, and maybe not so secret sauce if you want to share it out loud, but the elements that really differentiate your programs right now for engagement?
So, I would just simply say communication is important. And I'm working on what's now called the ESG. So thinking about social responsibility, corporate social responsibility for the environment, for society, and for in terms of governance of companies. And they call it greenwashing. And when someone's out there saying that they do more than they're actually doing. I will say that in order to move this forward, there has to be visioning, and there has to be evidence-based research, which shows the impact of what we're doing. So I think we do need both. I think the communication is going to be really important for the next couple of years. Being able to talk about well-being and its role within a better life, greater customer satisfaction, longer length of stay, and hence ROI, is going to be really important. And it's going to be hard for a lot of people to walk that talk 100%. I think we're on a journey, and I think we have to be aspirational at this point in time, but we've also got to have a pathway to getting there. And we've got to show that that pathway can work or take responsibility if it does not. We've got to be able to show our progress. So I think that websites are important vehicles to tell people how to look at the world. They're also important vehicles for showing how you do that, how you walk your talk. And so I think there's a very fine line. And I think that we have to be I think being aspirational on the website is absolutely critical. I think what happens on the floor is going to evolve over time. I think this is an uncharted territory for many people, to move engagement into a wellness orientation, a whole person orientation. We've talked about whole person, but we really haven't made that happen in as many settings as possible. We're now starting to move in that direction, and it's a journey. It's a marathon. It's not a sprint, and we're going to all have to move in that direction. We have to hold ourselves responsible, not to overpromise and underdeliver. We have to make sure that our aspiration isn't the equivalent of greenwashing, marketing that doesn't really show the consumer what they're really gonna get when they come in. But that said, we've got to set out the vision for the future. And the vision for the future is something that we're all working on achieving. I know at Juniper, we're not there yet. We're a heck of a lot further than a lot of people, and a heck of a lot further than we were 3 years ago. We will be much further along 2 years from now. I think what we need to do is demonstrate the value of bringing together care, service, and engagement. So it's not all about engagement, it's how we work together, it's that integration, and the value of that integration to a human being, to a human being's sense of self and their sense of value at the throughout their life, but particularly at the end of that life. So perhaps a little different than you were expecting, Sarah, but I think it's important to be aspirational at this point in time and do your best to walk the talk. But I think there's always going to be a little bit of movement there when you're leading an effort for an industry.
Yeah, and you both are committed to long-term change. It's a marathon, not sprint, as you both said. So you're right. Investment in that time and noting the progress and continuing forward.
I would just add to it. I think it's a journey. We're one step. We got a long ways to keep going. For us, I think for us is when we talk about holistic engagement for our residents, we also are doing this for our employees too. We want them to, the blue zones, those principals have had their lives and their families. So for us, we always look at what are we doing for our employees, because they are our reputation. So how do, we're still dealing with every community with shifts unfilled and those types of things. And it's difficult. And so how can we support them, do things for them, their families? They're paying in California $7 a gallon for gas and $6 in Oregon, and it's pressures on their families and their budgets and all those things. So how do we enhance their lives? How can we keep them engaged so that they can be good for their families or whatever they're doing, and doing that at the same time as we're trying to do the engagement for the residents, because we got to love them so they can love our residents. So that's kind of been our focus, is our staff and our niches and those types of things, and how do we enhance their life so that they can have the energy, the strength to do for our residents what we need to do for them.
Well, thanks. Well, actually, let me do this first. Thank you, Sarah, so much for helping me moderate this amazing panel. Chip and Lynn, I obviously want to thank you for your time and the time you spent preparing this panel with us today. For me, there were three core aspects. Is both of you at the end of a panel kind of acknowledging the fact that, quote unquote, we're not there yet, right? And Chip, obviously, the staffing crisis, even the cost we pay for gas, these are all detrimental to us being where we want to be. But I think obviously there's a lot of, quote unquote, silver lining in where we are, and definitely some of the things that we've learned in the past 3 years. And so I do want to thank you both for the things that you shared about the lessons learned, how you've enabled this interdisciplinary work. Chip, some of your ideas around the blue zone and some of these findings there. And I think the last thing I both want to acknowledge and thank you for, and please continue to do this, is being this CEO, right? This Chief Engagement Officer. As I mentioned, we need more of you. So yeah, just continue to be amazing. Thank you so much again for your time. And again, Sarah, thank you so much for your thoughts here. Have a wonderful afternoon, and we'll wrap up our second session here. Thank you so much. Please feel